Hello, Halton. Thank you for joining us today on Healthy Minds, Healthy Life. I'm your host, Nadirah Nazeer. Today, my guest is none other than the great Tom Adam, who is the Regional Councillor for Ward 6. We're going to talk about all the various different support systems that exist in Halton for your mental health. Tom, welcome to the show.
Thank you so much. It's really wonderful to see you and great to be on the show. Thank you for inviting me.
Yeah. Tom, I know a lot of people on your TV probably already know who you are, but can you give us a little bit more background about yourself?
Sure. So I've been a councillor with the town of Oakville and now with the region of Halton since 2003. So I've gone through a number of election cycles and come back each time. And I've been on the region of Halton side for most of that time, covering everything from the public works to some of the social services areas, including right now I'm the president of the Halton Community Housing Corporation. But I've also dealt with many of the local services at the town of Oakville, including a lot of the recreational programs, the library services, and many of these have an impact on people's mental health and the livelihoods that they continue on with. So there's parts at both the town of Oakville portion as well as the Halton Region portion that really have an impact on people's mental health. And that's, you'll see behind me, my screenshot is the town of Oakville. And that's why I'm showing that off as part of this as well, because we actually work together to provide a wide range of services that people need.
So can you share with me some statistics? What is the latest statistics specifically for Halton when it comes to mental health?
So mental health has become a growing area of concern in the medical field, in the healthcare field. Right now, in terms of Canadians, about 1 in 5 Canadians are experiencing some kind of mental health issue in any given year. Locally, our numbers are not far off. We recently did a survey where we had about 50% of adults reporting that they had their mental health worsen during the pandemic. And so not that those, that 50% of people are experiencing mental health crises at any given time, but it's a measure of how the last couple of years have really impacted people's mental health. A lot of parents also have great concerns over their children's mental health. That same survey showed about 80% of parents reporting some concern over their children's mental health throughout the pandemic. And so all of these things they're consistent with national data. So we're not tremendously different in Halton if you look at us versus some other part of Ontario or some other part of Canada. But that proportion of Canadians and Haltonians and Oakvillians who have indicated that their mental health has worsened throughout this last couple of years of pandemic, it's really increased substantially over time. And so that's what's driving the public health world to pay even more attention to mental health supports than they have in the past. In the world of public health, there's an old saying around public health, which is, public health is working when nothing happens. And so if you're doing a good job with your public health supports, providing people access to mental health things that they need, services that they need, then you can avoid the crises that will show up in your emergency department or show up on your 911 calls. And so it's from a public health perspective and a public community perspective, it's way less expensive to provide those supports early on than it is to deal with them as a crisis.
It's better to be preventative and more proactive instead of reactive.
Yeah.
So before we get into the support that exists in Halton, is there any demographic that is mostly affected?
Mental health is an issue across all age spectrums. So I would not try to single out any particular demographic as being the demographic that is of greatest risk. If you look at the support networks that are out there, they need to be tailored to the different groups. And so you might be dealing with a particular set of needs for young children, and those are going to be different than, say, those for teens or say new mothers. New mothers have an especially difficult time depending on what's happening in their household and how they're responding to having a newborn in the house. And then you go all the way up to seniors who face a different set of circumstances, often things like isolation. And so the need for services to meet these different groups of people's needs, you have to think about that. It's not a one size fits all kind of service. It's not like when the town of Oakville does snow plowing and we do snow plowing, we use the same kind of plow on every street. No, that's not how this works.
So Tom, let's talk a little bit about the support system that exists today in Halton. So what are the different support that we have today that people can engage, and in what way?
Yeah, that's an excellent question. And Halton Regions, we're very, very committed to improving access to services for residents, and that includes mental health supports and services. And we're really proud about the way we work with community partners to provide these services. Most of this kind of work must be done with partnerships. It's just not possible to bring it all in-house. And in fact, you probably, in many ways, you're going to be more successful working through others on some of this work. The mental health promotion work that we do, the partnership work, the funding work that we do, it all supports the mental health wellness and various initiatives in the community. We do those, the preventative initiatives through Halton Region's public health world. We do participation on a wide variety of community committees and coalitions. So that's working in partnership with others. We work really hard at trying to reduce stigma around mental health, sharing information, sharing resources with the community. We do that through social media. We do it through our website, halton.ca. So I'm sure you have seen some of the material that's out on social media from the public health realm that's coming out of Halton Region. And of course, we do one thing that most of the public probably don't know is that we fund community initiatives through what's called the Halton Region Community Investment Fund. And that fund, it's an allotment of money that we provide grants to various partnership organizations, and it's often multi-year funding for those organizations, and it would cover a really wide variety of services that are out there in different parts of Halton. And of course, we because of this push around mental health recently, there's more planning that's currently underway to build on the existing work that we've got. We've got lots of work going on in everything from the Halton Suicide Prevention Coalition, the Early Years Mental Health Committee. All the school boards are engaged with us as well. So we have these partnerships with them. And I can't go on without mentioning the Reach Out Center for Kids, which most people might know as ROC, and that's just a fabulous organization that we work with. We help fund parts of it. There's the Our Kids Network, the Canadian Mental Health Association, the Community Safety and Wellbeing tables. So there's a really wide variety of things that we've got going. And I think I've already mentioned our website, halton.ca. I try and mention that every 30 seconds or so here.
And I
do that because it's really, it's a central access point to a lot of things.
Absolutely. So for our audience out there, the only thing you have to remember from this show is halton.ca.
Yeah, that's right. So if you go to halton.ca and you will find within the public health section a mental health page, and within that page you will find access points to all of these organizations, all these partnership groups that provide emergency lines, provide detailed information about what you can do to support yourself, what you can do to support your family members or friends, all of those kinds of things.
And have you seen a significant change on people using all of those services pre-COVID versus post-COVID?
That's an interesting question about the volume of traffic that we see. I don't actually have stats on the number of people coming through the website or coming through the door specifically, but I can tell you that throughout the pandemic, I personally, as a counselor, received many more calls of what I would describe as a sort of a mental health nature. As a counselor, as a politician, as a counselor, you receive calls from people about all kinds of things, everything from potholes to, what's the recreation service that I want, to calls that come in, and after discussion with the person, you just have a sense that the person was almost just calling you because they needed to talk to somebody. And I was there, I had certain individuals who I was speaking to far more frequently than I would normally have, I would say. And the sense, I got this sense that this was basically a mental health call. And my colleagues had the same thing. So other council members were also receiving these kinds of increased call volumes that were not really associated with a specific issue. They recognized that, hey, there's something funny going on in the community. This wasn't happening pre-pandemic. So.
Okay. And to your point, it's isolation, right? People just wanted to connect with another person.
Yeah.
And it's really great to see that the town and the region is collaborating with some existing support system to provide more support, local support. Is there any local, I know there's a rock, I always drive by it on Iroquois Shore. There's a rock office there. Is there any other offices that are serving Halton regions here locally?
So there's a variety of local supports, and of course, people can also have the ability to reach out to their own family doctors. A lot of mental health services are actually provided electronically or through a phone call to initiate, and then you access the individual depending on what the service is required. And so, in terms
you say a phone call, which number is that?
So, you can call 311 and you can speak to somebody about mental health issues and literacy, and they'll direct you to the right place. I've talked to you about Halton.ca already. So, these are really the best entry points into.
So let's talk about Halton.ca, because a lot of our audience are a mature audience that doesn't really navigate a lot of websites. So once you get to Halton.ca, where do you go to get that information?
So, once you're at Halton.ca, and, you're going to find that there's on our current website, there's a section called for residents. And within that, there's a public health section, and within that, there's a mental health section. And so most of this information is housed within the public health part of services. And that makes sense because, this is really about public health. The public health element of what happens at the region is broad-based. It's intended to provide community level service. It's not the 911 kind of issue. So if you've got somebody who's truly in distress, call 911. That's the right place to go for it. And people shouldn't feel that it's the wrong place. They shouldn't feel, gee, this is a mental health issue. Why would I call the emergency department? Why would I go to the hospital? But if you've got serious mental health concerns that are going on in your household or with a friend, that can be the right place to go. And after they've looked at the individual and they've considered the issue, yes, there's going to be other supports that are going to be needed. Just as if you walk into the emergency department, you've got a broken bone, sure, they'll set it, but there's going to have to be remedial work done afterwards. You're going to have to go and probably do some kind of long-term exercises to get your arm back in shape or get your leg back in shape, right? So similarly for mental health, after an initial crisis is passed, there needs to be supports. And those medical professionals are the ones that can link a person to those supports.
And I really urge our audience, if you're not feeling well, if you feel off and you're not sure, if you don't feel comfortable calling 911, you can certainly call 311. And I didn't even know you can call 311. So thank you for sharing that, Tom.
Yeah.
So you can call 311 and talk to somebody whether you're a teen, a mom, an elderly, and you're not quite feeling emotionally well, reach out. I think it's easier to pick up the phone to call 311 than trying to go on a website. And that's why I was trying to kind of figure out what is the easiest point of entry for someone that needs help. And 311 is an easy access. You can call and reach out and talk to somebody, and they will provide you the help. And I was also asking about if they want to walk into a place, is there any walking support infrastructure that exists in Halton?
There are. We don't really. That's good. We don't really truly have that kind of simple walk-in kind of thing. Obviously, you can walk into a family practice. You can walk into the hospital and say I'm in mental health crisis. Those are places you can walk into. So it depends on the nature of the concerns that the person has. And which is why I don't want to say, no matter what you have, go here, because that's not the way mental health issues are. Mental health issue, it's very much like your physical body. If you've got chiropractic issues, you don't go to the blood clinic. So you need to make sure that you're focusing your energies in the right place, and that's why reaching out through some of these other locations electronically initially to determine where you ought to go is a really an appropriate way of trying to respond to it.
Okay, and
it's simple, right? It's very simple.
Absolutely. So you're picking up the phone, call 311. They will do the triage and figure out the best ways to get you help. And Tom, you engage with a lot of people on a regular basis for a number of years and years now. What is your top 3 advice for people to get the support that they need in Halton for their mental health?
Well, first of all, I think people need to recognize that they need to take care of themselves. So before I go to the question of where should you go for supports, you need to. My number one thing would be take care of yourself. I know you've had other guests on your show who have talked about various forms of taking care of yourself, but it needs to be reiterated. You need to make sure that you're eating healthy. You need to make sure that you're getting well-balanced meals, if meditation is the thing that you want to do, then meditation, getting lots of good sleep, making sure that you're exercising regularly. Some people find that keeping a daily journal is helpful. These are kinds of techniques that are important for ensuring your own preventative mental health. And I'll say you should stay positive. Nadirah, I've known you for a while, and I know you manage this one perfectly as far as I can tell. But all of these things, including maintaining your social connections with other people, I would say that all is number one. The preventative element of mental health is really important. If that fails, then there are other supports that are out there, and it depends on who you are, what kind of supports you need. So number 2 would be go and find the supports that you need. There are a host of organizations out there that provide advice, provide counseling. All of them can be found through halton.ca, there you are again. But go and find them. There's lots of them there, whether you're a teen, whether you're a parent of a young child, whether you're a senior dealing with isolation, dealing with various issues like that. All of those things you can find through there. So that's number 2. Go and find the advice you need. And finally, if you're in crisis, go find support. Go ask for help. There are crisis lines that you can access, and you can call 911. So that's if I was going to say 1, 2, and 3, those are 1, 2, and 3. Take care of yourself. Go find the supports you need, and if you're in crisis, reach out. So those are 3 really important elements to it all.
And remember, you can also go call 311. And you're right, mindset is everything. Having a positive mindset. So I have a question for you, Tom. How do you take care of your mental health?
Well, it's a wonderful idea. Great question. So you might know that I coach soccer, and I've coached soccer for years and years and years. And for me, coaching soccer is a great outlet. It's physical activity. It's also social connections with people who are almost always in a positive mood, and so it's all positive interactions that I get out of something like that. So to me, that's a really important element of things. So I know that when the pandemic hit and all these activities had to be shut down for a while, I had to find a new thing to do. And so for me, that meant getting out, making sure I was using our trails. So outdoor activity has always been a really important part of my life. And so whether it's soccer in the summer or it's trail hiking, those have been really important. So to me, that's been a core part of how I maintain myself, both from a physical health perspective, but also a mental health perspective.
And talking about that, the socializing aspect of it and getting out, is it on halton.ca, or is there another website that people can go to and see all the different events that's happening locally? I think participating and going to local events really can help you with your mental health.
Yeah, that's a great comment. We have actually at the Town of Oakville website, we do have an events page there. And certainly I know that all of our local media cover many of the events that are going on, whether they're downtown Oakville events or Kerr Street events or local fairs that are going on, or community cultural events that are going on. They're often advertised through the town site, but also through many of the local, Inside Halton or Oakville News. Those sites all would cover those kinds of things. And they are great opportunities to get out and see things and experience new things. But they're also great opportunities for people who have a little bit of extra time and want to volunteer their time. Many people speaking of mental health, many people volunteer as much for the social interactions and the benefits that they receive from a social and mental health perspective as they do for any other reason. And so, speaking of these events that are going on around town, choose the one that you really like and donate a little bit of your time to making it happen. So.
And Tom, are all the events back on track now?
Many of them are
back in gear.
Yeah, it's many of them are, and many organizations are back to back to play, but they're not. Many of them are not back fully. Many organizations, especially in the recreational world, while they're back to play. So, for example, soccer, which have been involved in for many years, I'd say it's back to maybe 80% play, which is there's still a relatively large number of people who have not returned to their original games, to their original activities, and I think that also plays a part in the mental health questions that we've been exploring today. When you've got a significant portion of the population who have not yet returned to those social activities, they might be sport activities, but they're also social activities, and so that plays a part in ensuring people's mental health. So I encourage people to find ways to go back to those things. And
Tom, is there any other things that we should know, or the Halton's folks should know about what's happening in Halton?
There's a lot going on in Halton, and I really encourage people to take part in the public discussions that happen on whatever issues are of concern to you, and whether it's mental health or public health issues or whether it's something related to local development that's happening in your community. We're going to have lots of discussions about how our community grows over the next 20 to 30 years. And I think those are really important discussions for our community to have as well. Recognizing the change in the demographics that we're going to see, and the way that that's going to impact, how we create a complete community, whether it's from a schools perspective, hospitals perspective, our roads and transit perspective. There's a lot going on, and I really encourage people to take part in those discussions. That's the best way to change your community.
Perfect. Tom, thank you so much for joining us today. Really appreciate all your great input. And don't forget, it's halton.ca is where you can get all the information that you need for all the support infrastructure that exists today within Halton Region. And I urge you to go check your local newspaper or Town of Oakville website for any event that's coming up. It's good to get out there, to stay social, to reconnect with friends and family. Thank you, Tom, for coming.
Thank you so much.
And thank you to our viewers for joining us today. And I look forward to sharing more information with you on your mental health and wellness. On that note, I would say stay positive and start believing.